ground truth thing is really this idea that local communities have very specific knowledge around what is actually happening in those communities. So a lot of times when, for example, an environmental regulatory agency has air quality monitoring, it's really important that that is reconciled with the community. So people are doing their own, where point source pollution is, or where a certain facility is, or really reconciling the data that we have with the knowledge in the community.
And so the bucket brigade means we're actually using buckets to capture it?
Yeah, so it's literally a bucket where communities get this technology where it captures the toxics in the air and it goes to a lab. And so when they're done, they actually have kind of valid research and valid data to be able to leverage for community change and for policy change and ultimately for public health protection.
Why does it matter that it sort of resonates with the community and you pay attention to the community?
Well, I think it's a tool that gives additional leverage to communities to be able to bargain at the table. So, I think historically in environmental justice, it's been the mother with the sick child who's telling the story, the personal story. But the stories themselves need to be supported by the data. That when communities hold that data, it's empowering, and it gives them the leverage they need to actually change policy. And ultimately, which is really the goal of environmental justice, is to protect their public health.
So how do you reconcile the motivation to have social justice against the cause with the need for empirical, objective data?
Well, I think that's the ultimate question of the conference, right? Is that, we have to have these mixed methodologies. We have to, develop technology that's able to be used for communities or at the community level and really allow these kind of two parallel tracks, one being the stories and the narrative and the experiences of community members that are impacted by environmental hazard, and then the empirical data that justifies and reconciles those stories. There's this disparity between what the science says and what the community's experiences. And I often talk about toxics regulation. So when we talk about health benchmarks that are made with lifetime cancer risk as the metric, that creates what's determined as safe. This is acceptable risk, and the idea of acceptable risk in policymaking does not jive with community's experience. So if my child has asthma and you're not using respiratory illness as a benchmark for public health protection, but rather using lifetime cancer risk, that's a real challenge. And so I think part of it is, as has been mentioned, is around how do you build the relationships, how do you acknowledge and bring humility into the conversations to acknowledge what communities are actually experiencing, what their perceptions are, and allow them to really tell the story through their own experience.
Tell me a bit more about what you mean by humility.
Well, I think when you come into communities, you have to recognize that there's cultural connections that you need to make. There's historical context that you need to accept. There's differences in educational attainment and the ability to understand and comprehend data. So I think a lot of times it's coming in with the acceptance that while as a scientist you've reached this level of legitimacy as a researcher, but that you don't know everything, and that it's important to connect with communities with their inherent value that they hold. So communities by themselves actually contain a lot of the knowledge that maybe looks very different than what would be in a peer-reviewed scientific journal.